Pawanmuktasana is a Sanskrit word which is derived from Pavan, Sanskrit wind, Mukta, to set free, and Asana, a pose. These exercises are very useful as a preparation because they will open up all the major joints and relax the muscle of the body. They are very beneficial for the body and can be practiced by anyone. They should not be neglected. Beginners, as well as people who are out of shape, should put an accent to this series of exercises as they slowly move forward into the more advanced asanas. These exercises are very good for regulation of the body fluids, and we are going to do combination of exercises from the anti-reumatic and the digestive abdominal group. Anti-reumatic group. These exercises include movements of the joints, loosening them up. They are excellent for people with rheumatism, arthritis, high blood pressure, heart problems. With this series, the joints are lubricated and relaxed. Digestive or abdominal group. These are very good for releasing and strengthening the stomach and the digestive system. They are very beneficial for people who suffer from indigestion, constipation, acidity, excess wind or gas, diabetes, and varicose vein. Sit on the floor with the palms of the hands placed on the floor, just behind the buttocks. The back, the neck, and the head are in a straight vertical line position. The legs are outstretched. The elbows are straight. Lean back slightly using the support of the arms. Start with the toes of the both feet. Move them backwards and forwards. Inhale as you move the toes backwards. Exhale as you move the toes forward. Continue moving your both feet backwards and forward. Inhale as you move them backwards. Exhale as you move them forward. Rotate both feet together around the ankles in the same direction. First in one direction and then in the opposite direction. Now bend the left knee and place your foot on the right thigh. Holding the foot with your right hand, rotate the foot a couple of times. First in one direction and then in the opposite direction. Change the foot. Now bring your right foot over the left thigh and rotate a couple of times, first in one direction and then in the opposite direction. Clasp the hand under the left knee and straighten the left leg, pulling up the kneecap. Do not allow the heel to touch the floor. Bend the left leg at the knee, bringing it towards the chest and the heel towards the buttocks. Inhale by straightening the leg. Exhale by bending the leg backwards towards your chest. Repeat 3 times. Do the same with your right leg. Repeat 3 times. With the hands clasped under your left knee, rotate the left shin 3 circles, first in one direction, then in the opposite. Repeat the same with your right leg. The next exercises should not be performed by people who suffer from back conditions such as sciatica, and slip disc, heart conditions, high blood pressure, and people with recent abdominal surgery. Please consult a doctor before practicing the following 4 exercises. Lie down flat on your back with the legs stretched out and together. The arms are on the side with the palms down on the floor. Raise your left leg and rotate 5 times in each direction. Raise your right leg and rotate 5 times in each direction. Raise your both legs together and rotate 3 times in each direction. Bend the left leg at your knee and start rotating around your left hip 5 times in each direction. Bend your right knee and rotate around your right hip 5 times in each direction. Stretch your arms above your head with the fingers interlocked. Exhale and bend forward, bringing your left knee to your forehead. Inhale, lie down on the floor with your arms above your head. Exhale, bend forward and bring your right knee towards your forehead. This is 1 round. Do 2 more rounds. After the last round, as you are bending forward, bring both of your knees to your forehead. Repeat this 3 times. Inhaling, raise your legs, arms, shoulder, head and trunk off the ground around 15 centimeters off the floor. Balance the body on the buttocks and keep the spine straight. Retain the breath for some time and then exhale and lie down on the floor, relaxing your body. Repeat 3 times. This is the Naukasana, or the boat pose. Now bend your legs at the knees, with your arm beside your body, with the hands against the floor. Twist your knees on the left side and simultaneously the head in the right direction, and exhale. Inhale, bring your legs and head in the start position. Exhale and twist in the opposite direction. Continue in a sitting position. Bend the left leg and place the heel at the perineum, touching the inside of your right thigh with the left sole. Stretch your left hip by pressing your left knee with your left arm towards the floor. Do not press too hard, but only as much as you can and as you feel comfortable. Now, grab your right foot with your both hands and bend forward as much as you can. Don't hurt yourself. Take 3 breaths in this position, and with each exhalation, try to bend further and relax. Now change the legs. Outstretch the left leg and bend the right leg. Press your right knee towards the floor, and then grab the left foot with both hands, bending forward as much as you can. Stay 3 breaths in this position, and with each exhalation, try to bend even further down. Now take your left leg in your both arms and move it left and right like rocking a baby. Before you put your leg down, bring your foot as close to your chest as it gets. Take a few relaxing breaths in this position, and by exhalation, bring your leg down, placing the left foot as far up on the right thigh as possible. Press the knee down, stretching the hip joint. Change the legs and do the same. This time, take the right leg with your arms. Move it left and right like rocking a baby. Stretch your hip by bringing your right foot as closer to your chest as possible. And then, bring your leg down by placing your right foot as far up on the left thigh as possible. Bring the left foot over your right thigh. Rotate your knee in circle by using your left arm and try to make the circular movement as large as possible. Rotate your knee in both directions. Straighten your left leg and do the same with your right leg. Continue with the butterfly position. Bring your feet together and the heels as close as possible to your body. Bend down, pressing your legs down with your elbows. Try to touch the floor with your knees, but do not strain yourself. In the next phase, with your arms, push gently your knees towards the floor, allowing them to come up again. In the next phase, with your palms right behind your buttocks, lean down on your arms and move the knees towards the floor using the thigh muscles. Do not force yourself and breathe normally. Continue with Siddhasana. Bring your right heel to the perineum and the left foot between the right thigh and the right calf. Move the left heel as closer to the perineum as possible. Stay 3 breaths in this position and try to consciously relax any tension in your hip area. Use your left arm to press your left knee towards the floor. Do the same position, changing the position of the legs. Start with your left foot and bring the left heel to the perineum. Place the right foot between the left thigh and the left calf. Relax with a few breaths, and with the right arm, press down your right knee. Now bring your right foot under your left thigh and place the left foot on your right thigh. Press down your left knee a couple of times. Do not strain yourself. If your hip joints are stiff, they will loosen up very quickly with regular practice. Lift your left leg and place it behind the left buttocks, stretching your left hip joint. Do the same position, this time with your left foot under your right thigh. Place the right foot on the left thigh and press down your right knee. Relax from this position by stretching your leg behind. Now you are ready to sit in the lotus pose. Start with the leg which is more flexible and place the foot on the opposite thigh. Then bend the other leg and place the foot on the opposite thigh. Sit in this position for 5 breaths and try to relax all the tension in your body. Do not strain yourself to do this. If your hip joints are not open enough, or if you have too much pain in your knees, this will come in time. If you suffer from sciatica, sacral infections, or weak, injured knees, do not perform this asana. Release the lotus pose gently. Outstretch your legs and separate them apart. Stretch your arms at the shoulder level. Keeping the arms in a straight line, exhale and twist to the left, bringing your right hand down to the left foot. Stretch the left arm behind your back. The arms should remain in a straight line. Turn your head also to the left and gaze at the left hand. Now twist in the opposite direction. Inhale and come to the center position, and by exhaling, twist to your right, bringing your left hand down to the right foot. Turn your head right and gaze at your right hand. This is 1 round. Do these 3 rounds, and when you are about to do the 4th round, instead of twisting, just bend forward with your body, grabbing your feet, right hand on the right foot and left hand on the left foot. In this position, holding your feet as you breathe out, try to relax and bend further down using your arms. Do not strain yourself. You should feel the pressure at your lower back and the sacral joint. Relax your legs by shaking your calf muscles. Sit in a thunderbolt position or Vajrasana. With your knees on the floor, separate the heels and bring the big toes together, and with your buttocks sit on your feet. If you feel pressure or pain in the knees or any kind of discomfort, use a pillow. You can place your pillow under your knees, under your feet ankles, or you can place it on the calf muscles before you sit on the feet. Try to find how to make this position as much comfortable as you can, because from this position we are going to exercises for hand joints, shoulders, and neck and eye exercises. Anyway, if this is too hard for you to sit in this position, then choose another sitting position which will be more comfortable for you. Important is that you have a straight back. Now, from Vajrasana position, outstretch your arms in front of your body at the shoulder level. Breathe in and open your palms, stretching your fingers as wide as possible. Breathe out, close the hands into fists with the thumb inside the fist. Do this 3 times. With the next inhalation, bend the hands backwards from the wrists with the fingers towards the sky. Breathe out, bend the hands down with the fingers towards the ground. Do this for 3 rounds. Put your right arm behind your back and with your left arm outstretch it in front of you. Rotate your fist around the wrist. First in one direction and then in the opposite direction. Change your arms. Do the same with your right fist. Outstretch your both arms in front of you at the shoulder level. Open your hands with the palms towards the sky. Breathe out. Bend the arms at the elbows and touch your shoulders. Breathe in and straighten the arms in front of you. Do this 3 times. When you inhale for the 4th time, straighten your arms on the side at the shoulder level. Breathe in, bend the arms and touch the shoulders. Do this for 3 times. On the 4th round, with your both hands on the shoulders, start rotating them with the elbows. Breathe in as you move your elbows upward. Breathe out as you go down with your elbows. Do this in both directions. Put your hands down on your thighs. The following exercises release tension and stiffness in the neck. Breathe out and bring your chin towards the chest and fix your eyes on the top of the nose. Breathe in and move the head backwards, fixing your eyes in the point between the eyebrows. Do not use too much force. Do all the exercises gently and slowly with minimum pain. Do this for 3 times. On the 4th time, breathe out and move the head on the left side. Breathe in and bring the head and the neck in a straight position. Breathe out and move the head on the right side. Breathe in, bring the head in a straight position. This is 1 round. Do 1 more round. After the last round, breathe out and turn your head on the left like you are trying to see something on the left side. Move only the neck and the eyes. Breathe in and bring the head in the straight position. Breathe out and turn now on the left side as much as you can, turning your eyes on the left as well. This is 1 round, and after the 2nd round, remain with your head and neck straightened in 1 line. From this position, start rotating your head with your neck gently and carefully. Do 1 or 2 circles carefully in both directions.